had our twin sons prematurely. There were 26 weeks gestation.
I really, really got scared because I thought, how could this happen to us? How could, we've been trying so long.
To see your child that little look so lifeless.
He had to learn to drink water, to learn to walk, to learn to sit up.
We saw him for a few seconds and he managed to cry. He let out one wah and they're so happy.
He wasn't doing good at all. He couldn't breathe on his own, couldn't eat. He was helpless.
You really never realize the need until you have it.
There's no other place, I believe, in the state that you would want to have your child at in Kapiolani.
My families and our families all take part, and somehow it's touched by Kapiolani Hospital in some way or another.
What are the enduring institutions? What are the needs out there off into the future for generations to come?
I think it's time to build the physical plant to help it move into the 21st century.
There's a lot of good causes out there, but personally, it's tough to find things that you would put higher than this.
Debbie and I have been trying to have a baby for a long time, past couple years or so, and we underwent numerous rounds of fertility treatments. Finally got pregnant, and we were thrilled beyond belief.
One day he just had minimal movement. We went through some tests and they noticed that the baby's heartbeat was very inconsistent. So he would have a regular heartbeat, then suddenly it would drop very low and occasionally even disappear.
I walk in the room and Debbie was crying. And I thought at that point, we had actually lost the baby.
And so throughout the night, we underwent numerous tests, and it finally got to the point where they said it's necessary to do an emergency C-section.
And I remember one doctor telling us that the boys were going to be born 8 weeks early, and he said that there may be problems, complications, sometimes things aren't always developed, trying to prepare us for the worst case scenario. 10:30 Maui, we left. We came here early in the morning and I gave birth 2 o'clock the next afternoon.
They were 32-week twins. That's a very young age to come. It's 2 months early. But I remember most about them as they ended up being, in a sense, a tale of two worlds. Whereas one went in one direction, and unfortunately, Cam had to go in a different direction because of his illness.
Maya was normal. She was really healthy. She was thriving. Just one day, we just noticed that she didn't look well. She was losing weight and she was very pale. And so we went to the ER, and then as soon as we got to the ER, they admitted her right away.
Maya was a really sick little girl, and she had a stomach virus. She was dehydrated to the point where I remember it was hard for the ER nurses to even get an IV in her.
You're just like, there's no way this is happening, and the anxiety of your kid being admitted, you're just like, it was surreal.
My pregnancy was going along well, and maybe about the 23rd week, I was starting to get pains. One night when the pains were really bad, I had called the OB again, and he said go to emergency at Kapiolani. They took a lot of tests, they were rushing, and I had preeclampsia, and they told me that they do a C-section then.
Part of the problem with preeclampsia is that it can be threatening to both the mother and the baby.
At 25 weeks in my pregnancy, LJ was born. He weighed 2 pounds and he was 13 inches long.
Cody's been through a lot. He's always been a happy boy, well liked by his teachers, his friends.
I like to do basketball, volleyball, and then I like to watch baseball. Getting to school on that day, that's all I remember.
He was complaining of a headache, and the school called my wife because he normally doesn't get headaches, and this time was different. It was to the point where he was screaming because the pain was pretty intense.
On July 14th, 2004, we had our twin sons prematurely here at Kapiolani. There were 26 weeks gestation, which made them about 14 weeks early. I remember delivering Kainoa first. When Kainoa came out, I could feel Kapono move up instead of coming down. So they decided to do a C-section. So I had one child naturally, one child via C-section, and then it wiped me out. And then the next thing I remember is I woke up in the ICU the next morning.
I don't really cry that often, and I remember reaching up to my face, and I had the mask on already, and it was all wet, and I was just so panicked that I was crying on it, and I didn't even know it. And the surgeon who was waiting with me to go in, he looked at me and said, "I do this all day, and your baby's gonna be just fine."
Well, when Braden came out, he was distressed. Quickly remove the umbilical cord from around the neck, we clamp it, and then we immediately hand the baby over to the neonatologist so they can do their job.
I remember Debbie saying, "Nick, he's out. How does he look?" And I had no idea how to answer the question because he was just kind of just limp, and you could tell that he wasn't supposed to be out. Dr. Diamond, he jumped in and he said, "Oh, they got to do a few things, but he looks good." Everyone knew exactly what they were supposed to do. Everyone was very, very comfortable and confident. You just got that feeling.
After the cesarean section, we take the placenta and we send it to the pathologist. And there they found that Debbie actually had a rare placental condition, which often can lead to intrauterine fetal death.
What really struck us was all the nurses there. All they wanted to do was teach us how to care for the baby, and they were just willing to share everything. They wanted us to ask them questions, and they were so open and had so much patience, and it just really made us feel so comfortable that Braden was in such good, caring, loving hands.
And he went from 3 pounds, I think he's over 20 pounds now. He's a little on the short side, but the doctor said, "Don't worry, he's short and fat, just like his dad was." To this day, we are so thankful. The parking attendant, when we first pulled up at 11 p.m., I thought he was gonna yell at me, but he was basically like, "No, go park over here, forget about the car, we'll take care of it." And coming from San Francisco, your baby could be in danger, but they'll still tow your car. The cleaning staff, the custodian, she spoke Chinese to us, and she said, "I've seen so many babies come and go, your baby's gonna be just fine." She didn't even know us. All that fear and the anxiety and the paralysis, it comes back, and it is totally offset by, I remember all the smiles and the support that we were given by everyone that worked there.
It didn't hit me that they're not okay yet until we went to see them. The first time I saw them in the NICU, and they had Velcro, like a mask, and all these things hooked up to them.
Cam developed a bacterial infection called E. coli sepsis that overwhelmed his body, but it quickly spread to his brain as well. He developed bacterial meningitis.
And they isolated Cam from everybody. They pulled him away from race and stuck him in his own little room. The doctor said most babies that get this die within 24 hours.
To hear the news about Cam that he's sick and might not make it through the night, that was gut-wrenching. I felt like I got the wind knocked out of me.
Cam's turning point was really just a couple of days after he was very sick. And as soon as that time passed and his blood pressure stayed strong, we were able to wean him on his ventilator. We knew at that point that he was going to survive.
The Kapiolani staff made a scary situation seem not so bad. Race is more of a mama's boy, and Cam is more of the go-getter. He likes to throw stuff, kick stuff, run. Everybody was just welcoming and warm, and we couldn't have done it without them.
And then I think with Maya's case, I think what ended up happening is they thought that after a couple days it would pass and then that she would be able to go, but she got worse.
She was very dehydrated. She couldn't even keep anything down.
The severity of the dehydration was more than most of us would be comfortable with, so we started IV fluid infusion.
Well, for Maya, the turning point was when she could, tolerate small amounts of liquid.
Clinically, she was improved, so her face looked visibly different.
She just turned 2. She's talking, and she's amazing. I couldn't imagine another hospital to go to. When you have such a small child and you have a child that's sick, you want to make sure that they get the best care possible.
He didn't pass the newborn hearing test, and he came home with oxygen tank and a monitor. When his asthma would flare up, then sometimes we would come to the ER like 3 times a year. He had a sign language class. He needed speech therapy. He visited his heart doctor and eye doctor regularly. It wasn't always easy raising him, but today he's a really good teenager. He's very honest. He's what you see is what you get.
Thank you to the nurses and doctors at Kapiolani Hospital and the NICU, because without them, who knows if LJ would have made it.
Basically, I don't understand what was going on. That was the biggest concern. How can a healthy boy that I saw in the morning, that life can turn so quickly?
He had a sudden onset of blood in his head, rendering him unconscious. He required help with his breathing. He required a tube to help drain that blood until the swelling could go down and he could wake up. That, in his case, took several weeks.
They did a gamma knife radiosurgery. It involves 301 separate gamma rays to hit one spot and then it will kill the AVM.
And as the days went along and he started to come out of sedation and he went through therapy.
He had to learn how to walk all over again. We used special devices like walking sticks. He eventually progressed to running, jumping, running upstairs.
It's hard.
He was able to walk out of the doors. And actually, if he wanted to, he could even run out of the doors. From the time we got here, we're under such care, such warmth. So thank you very much, and God bless you all.
Kapono had a disease process occur to him, which is called an intestinal perforation. It's fatal in more than half the babies that it happens to.
You don't know which child to sit by, which child to be by, spend an hour here, an hour there, or we would switch off if we were both were there.
But every time I see Kapono, I would stay with him a little bit more longer than Kainoa because he was the more sick one. Kapono, every time you try to talk to him, his numbers would always go up. And Kainoa, he was his own world already. He was like, he didn't want to look at us, just to cover his face. And, you're my dad,
Yeah. The easiest way for people who haven't been in the unit to understand is it's a roller coaster. You can go from having a good day to just feeling like you just jumped off a building. It's just hard.
The process of watching a baby get worse and seeing that we're losing the battle, we see that we're just not getting there. We see that we're heading in the wrong direction and we keep trying.
It's not about us anymore, and we have to agree that he fought all he could fight. So we told Dr. Neil, the minute that you cannot guarantee us that he's not suffering, just stop already, because it's not fair to him. So September 14th, which is exactly 2 months to the day that they were born, we got the call. They just said, we cannot, this is time already, we cannot do anything further. And they had to roll Kainoa around the wall to be with Kapono, and the nurses, they were just awesome. And they gave us whatever time we needed to be together as a family. So that I appreciate so much. And we personally think that Kapono gave whatever he had left to his brother, because from that day on, Kainoa just improved. And I mean, just complete turnaround. Kainoa is doing great now. He just has his asthma that he has to deal with, and then he has some speech delay. But it's nothing we cannot handle. From where we came to where we are now, nobody believes us that he was 2 pounds. Nobody believes that, you know, we almost lost him. Some people think like, oh, I'm so sorry, but no, we're not sorry, because if it wasn't for Kapiolani, we wouldn't have had those 2 months. It would have ended the day he was born. So we appreciate everything, every moment that we did have with him.
You know, you really never realize the need until you have it. And as soon as you have that need, that specialized care for one of your children, you are willing to do absolutely anything to make sure they get it.
There's so many things that we can support and frankly need to support, but really what it gets down to is priorities. And I can think of no greater priority than the need to support our young people.
You know, we supported the campaign in 2 ways. We supported it with a company gift, but we also supported it with an employee giving campaign, right? And we think that's important because that really shows what our people believe in.
Our goal with Alexander Baldwin's charitable giving program is to strengthen communities where our employees live and work. And Kapiolani is a very important part of this community because of the quality medical care it provides, and it provides to everybody, regardless of ability to pay.
Our primary asset for the whole state, in fact, you know, one would say for the whole world, are our children. And if we can't provide them with proper care in the event, again, that something, you know, does unfortunately go wrong, there is no other place, I believe, in the state that you would want to have your child at than Kapiolani.
After taking the tour, my counterpart, who was the president of the association, we sat there, we talked to each other at that point, and we said, you know what, let's do this at least for the next 10 years, because I think this cause for what we're doing was well worth it.
The building of our new NICU with individual rooms is going to be very, very important to us. We all understand in the NICU just how important the parent's role is to the course of the babies, and for them to get to the point of being ready to go home. If these parents don't want to leave the bedside, they don't have to. Parent touch is important. Being there to always be informed of what is going on with their baby is important. True family-centered care will occur in our NICU in a way that I don't think we've ever imagined we'd be able to experience in neonatology.
At A&B, we're very comforted knowing that there's a quality medical facility that we can have all of our families go to right here locally without having to travel to the mainland.
The idea of having to pick up and go to the mainland or somewhere to get the proper care and the disruption, you want now, you want here.
And really what's important, I think, for the leaders in the community to think about are, you know, what are the enduring institutions? What are the needs out there off into the future for generations to come?
It's only us. We're an island community. You only need to look around, very small group of people that have the ability to make contributions at this level. And we need to pull together to make sure this resource stays available to the people of Hawaii.